Now, the Special Investigating Unit has welcomed Gauteng Health Department's move to suspend officials linked to the corrupt COVID-19 PPE contracts. The 9 officials were pointed out in the SIU report following lengthy investigations. For more on this conversation, we're joined by SIU spokesperson Kaizer Kganyago. Kaizer, thank you so much for taking this time to speak to us. Good evening.
And good evening to your listeners.
Let's start, as you say, as the SIU, you welcome this action that has been taken, but let's take a few steps back and talk about the role that you played as the SIU and how did this come about?
Yes, thank you very much, and thank you to your viewers. What happened here is that when this matter came out into the public, the department or the Gauteng Premier's office then approached the SIU to say that they want the SIU to come and assist in the investigation of this. In principle, they are the ones who are doing the investigation. We were now only helping them to achieve what they needed to be achieved. In terms of our law, we've got a section that deals with what we call a secondment, where we then second officials to the Premier's office, and then we do the investigation. And we did it as quickly as we could, and we found what we found, and we gave the report back to the Premier in December of 2022.
Well, what were the investigations based on? As you say that it was a secondment where the Gauteng Health Department itself was also doing these investigations.
It was, in principle, the expenditure that was done by the hospital in relation to COVID-19. You remember at that time there were a lot of things that were bought. But what was amazing is that a small hospital was spending so much money around the issues that related to COVID-19, and therefore there were also scandals around the fact that they were even buying things that were not supposed to be bought, like skinny jeans and so on. Therefore, at the end of it all, this matter came to our attention, and we then went and we investigated all procurement that was done during that time of COVID-19 in the hospital.
What were the investigations specifically around the, lack of a better phrasing, dodgy contracts around COVID-19? Was that the scope, or were there more beyond that?
It was just the transactions that were dealt with during that time. Whether they were part of COVID-19 or not, but they happened during the same time, because those are some of the things that accordingly we found that Babita was worried about when she had to process some of the things that were done there, and she was seeing all this expenditure that was out of the normal expenditure that you'd get from a hospital as small as that. But in the main, it was more issues that related to COVID-19 at that hospital.
Well, you touched on the skinny jeans matter, which was well ventilated in media and otherwise. But what are some of the other things, if you're at liberty to share with us, that you found as the SIU as you investigated in this dodgy contract?
Among other things, we found that there were contracts that were given to basically the same people again and again and again. It was a group of companies that are part of same people that were given, say, this job. Therefore, it was big amounts of money that was paid for masks. It was big amounts of money that were paid for what do you call the PPE? Because sometimes when we say PPE, we only think of masks. We're talking about the overalls that they wear when they go to surgery. We're talking about those shoes that they wear. Therefore, they were buying extraordinarily around those issues. And that is what was really what caught the attention of the Department of Health in Gauteng, but also of the Premier's office. And therefore, that is what we got in to assist in investigating.
Was this a final investigation from your side as the SIU? And the reason I'm asking, Kaizer, is that normally we hear of the phrase preliminary investigation.
In this particular instance, in relation to the secondment, we have done the investigation. We have found what we found. But when we were doing the investigation we found that there is a need now for us to do a proclamation. Because when we investigate in a secondment, we don't exercise our full rights as the SIU. Because now we have done this investigation, we have found that there is a need for us to now recover money. And that would need us to have a proclamation. That is why when we gave the report in December to the Premier, we then said, we are now going to write to the President to get a proclamation so that we can finish up what we have been doing. And that is what we did. We have now returned to, drafted a proclamation with all the findings that we have, and we are just waiting for a signature from the President and gazette it. And once that happens, we will finish off the investigation, because that way we'll have the powers to then go and take this matter to the special tribunal and recover. In that way, we'll be able to follow these people who are now resigning because they don't want to be disciplined. Therefore, we need to block their pensions. We need to make sure that when we recover, there's something that we can get from them.
And I mean, I want to touch on that issue of freezing the pension benefits. But before we get into that, the Gauteng Health Department announced that the disciplinary action is being taken. From your part as SIU, do you have a role that you play in that regard in determining the kind of action, or is it incumbent on the Gauteng Health Department to decide what sort of action to take against those that you pointed out as having been involved in this contract?
Yes, we found what we found against these officials, and we gave that evidence and a recommendation to the Department of Health in Gauteng through the Premier's office. Therefore, what they are doing is as a result of recommendations that come from the SIU. And therefore, we don't end there. What we then are going to do is our investigators, because they've been part of this, they are now going to serve as witnesses in all of these disciplinary hearings that are happening, so that they can give first-hand account of what happened. That is our role in this particular one.
How far does this go, Kaizer, in terms of the people involved, in terms of leadership at the hospital? And I'm saying this because, and I'm sure I can mention the name of the CEO who subsequently was named, but I understand that he has been cleared. How far in terms of leadership at the hospital does this go?
It is mainly the people in the finance and the people in the supply chain that were involved. But obviously there will be one person here. If you look at our statement, we are talking, for example, the person who was a chief physiotherapist resigned because she was this person was part of this. Therefore, there are medical officers who were involved. There was a seasonal this medical officer who used to come not on a frequent basis, was not contracted per se, but was seasonally coming there. The person that also stopped working there. Therefore, supply chain people, people in finance, they were involved in this matter.
And does it extend beyond the hospital? And the reason, again, Kaizer, I'm asking this is that we know of the case of Babita Diokaran, who was gunned down after she flagged some irregular contracts, which one would say that maybe this goes beyond the scope of the hospital in that regard. Have you found anything to suggest otherwise in terms of that?
Not that I know of, but possibly because we are going to do further investigation, it might lead us to that. But obviously, the payments were done centrally by the Department of Health in Gauteng. That is why, because the late Babita was chief director there in the section that deals with the payments. Therefore, that is why she had to flag that, because it was very unusual all of a sudden to have so many of the contracts that are supposed to be paid in a hospital as small as that.
You touched earlier on, and I did say that we'll come back to it, the issue of the freezing of benefits of officials, as you say, who are some leaving the hospital itself amid this corruption probe. What are you aiming to achieve with that, and what is the process like to make sure that those pension benefits are being seized?
Yes, what we do is we have realized that when people do wrong things, and then there comes a time when they have to be disciplined. In the previous era, they would just resign, take their pension, and that would be the end of it. And when you then come back to recover, there's nothing to recover. And we then said, no, it cannot be like that. We then, in a case where anybody resigns amid a disciplinary hearing, we then freeze their pension until we have an opportunity to determine whether they are liable to paying anything. And once we find that they are liable, then those pensions, we then approach the special tribunal again, and those pensions will then be forfeited to the state as payment of what they would have been owing government.
At the risk of putting the cart before the horse, I mean, as you say that you're looking at freezing their pensions, which ultimately will be an attempt to try and get back and recoup some of the monies that were swindled from the hospital. But is there any further action that you, as the SIU, can take in terms of arresting them for corruption, for this sort of crimes, or does it only come down to that?
No. From our side, the law or the SIU Act says that when we do our investigation and we find that there is criminality, because it doesn't come out to say every time we investigate we'll find criminality. But in a case we do, then we then package that criminal act, package the evidence that goes with it, and give it to the National Prosecuting Authority, who will then take it from there in terms of working with the Hawks to arrest the people and to prosecute them. Therefore, that part we do as a matter of principle. There are three things that we do, which is the first referral is disciplinary, which is the result of why we are talking today, because now the department has started the disciplinary process. The second part is to recover the money, which is what we will do when we take this matter and cancel the contracts and recover the money. And the third one is the issue that I'm talking about now of prosecution, and that we do together with the National Prosecuting Authority, with our sister law enforcement agency.
How much money are we talking about here? Because I'm just thinking, will the pension funds of these people be able to cover those amounts of monies that we're talking about here? Because I remember there were irregular contracts when Babita Deokaran brought this to the public or to the fore, that we talk about at least 1 billion rand.
Yeah, no, I don't have the figure with me, Marara. It's just, but it was a lot of money. Therefore, what we then do is we look at liability. It doesn't necessarily mean everything is irregular. You'll find, for an example, that if you are supposed to charge 50 rands and you charge 200 rands, therefore, we minus the 50 rand, and then the 250 will then be what you owe, because if you cancel the contract, you cannot benefit from an unlawful contract. But we look at liability for each and every person. And we might find in somebody else it's a lot of money, in another one there is little money, that depending on the liability or the involvement of an individual. Therefore, if they are unable to pay that money, you must understand that therefore that becomes a debt like any other debt. And therefore, we will then have to recover that debt, like all the debts are recovered by taking some of the things that you owe, so that you'll be in a position to pay your debt.
Kaizer Kganyago, let's leave it there. Thank you so much for taking this time to speak to us. Appreciate your time.
Thank you very much.
That is SIU spokesperson Kaizer Kganyago just talking to us about their reaction to the action that has been taken by the Gauteng government or Gauteng Health Department after they decided to suspend and relook into some of the issues of those members or from the Tembisa Hospital that have been found to have been involved in dodgy contracts.